Hello, and welcome to Conversations from the World of Allergy, a podcast produced by the American Academy of Allergy, Asthma, and Immunology. I'm your host, Dave Stukas. I'm a board certified allergist and immunologist and serve as the social media medical editor for the Academy. Our podcast series will use different formats to interview thought leaders from the world of allergy and immunology. This podcast is not intended to provide any individual medical advice to our listeners. We do hope that our conversations provide evidence based information. Any questions pertaining to one's own health should always be discussed with their personal physician. The Find an Allergist search engine on the Academy website is a useful tool to locate a listing of board certified allergists in your area. Finally, use of this audio program is subject to the American Academy of Allergy, Asthma, and Immunology Terms of Use Agreement, which you can find at www.aaai.org. Today's edition of our Conversations from the World of Allergy podcast series will discuss the hot topic of COVID vaccine hesitancy. And we are extremely pleased to welcome Dr. Juanita Mora as our guest for today's episode. Dr. Mora is an allergist in solo practice at the Chicago Allergy Center in Chicago, Illinois, and also spends time teaching trainees through her academic appointment at Illinois Masonic Medical Center. In just February 2021, not that long ago, Dr. Mora was highlighted as a Quad AI practice champion based upon her tremendous work in her community and beyond. She spends her time alleviating fears and mistrust of public health measures related to the COVID pandemic and more recently with vaccines. She is the perfect guest for today's episode. Also, as the oldest child of immigrant parents from Mexico, Dr. Mora has been using her own life experiences and fluency in Spanish as part of her outreach efforts within the Latino community and other underprivileged patient groups. Dr. Mora, thank you so much for taking time to join us today and welcome to the podcast.
Thank you. It's my pleasure to be with everyone today.
I'm very excited to talk with you on so many topics, but I'd really like to start learning more about you and your fascinating background, if that's okay. Would you mind just sharing, how your upbringing contributed to you becoming the allergist and really advocate that you are today?
Absolutely. So I'm a first generation Mexican American, oldest of 5 kids. My first language was Spanish. I learned English once I got into pre-K here in Chicago. And as a little girl, I remember being the one as the oldest to help translate when my grandparents would go to the doctor or my parents would go to the doctor. And I remember learning really early on the lack of representation or having people to really talk in your language and be able to help you. And, looking back then and now at the statistics, it's one Latino doctor per 8,000 Latinos in the US. So definitely a shortage. And I remember as a little girl thinking, I want to grow up and make a difference in this community. I don't want people to wait that many hours in a waiting room or in an emergency room to see a doctor. I want to be a face just like theirs. I'm coming from the same background. This is kind of like my family. And I want to grow up to make a difference and be a voice for those people that really didn't have a voice. And so this is how my birth into science and medicine was born, my love and passion for it. And I wound up doing all my career in Chicago. I did med peds residency at Rush, followed by allergy and immunology and fellowship. And I thought, Dave, that I was going to do primary care because I loved internal medicine and I loved peds as well too. But then I rotated through allergy and immunology and just fell in love with the field. I mean, I love the complexity of it, how, obviously we still treated the whole family, but yet there were those rare cases that kept your science mind going, those immunology cases as well, too. And suddenly, it kind of all ties in our journey because it also allowed me to have time to do advocacy work, which I loved. I was able to do outreach into the community, mentor young people as well too, as I went in first generation, going to college, going to medical school, everything else. And what I found out most is once I went into private practice, 5 years into private practice, I partnered up with the American Lung Association, initially as a clinic partner, and then became national spokesperson for the American Lung Association. This is my 4th year. And I have to say that American Lung Association made me find my voice and my passion as well, too. And this pandemic just kind of exploded it to another level. So, I'm enjoying the journey and I'm enjoying everything. I'm loving what I'm doing now.
Oh, what an amazing story. I have to ask, do you still serve as a translator for your family members?
no. Now they call me for everything. I'm sure your parents do too, everyone. Because we're
Yes,
supposed to know
yes.
every answer in the book.
Yeah, and for myself as a pediatrician, I get to say, sorry, I forget all that. So call your doctor. Well, as you mentioned, you've spent really your entire life, and especially your training and medical career in Chicago. And I'd love to hear from you. What have you learned throughout your patient interactions over the last couple of decades? Where have we improved from when we started, where you started, and what areas really still need to be addressed?
Sure. So Chicago's my hometown. I completely love it. It's diverse, beautiful melting pot on so many cultures and so many levels. But what I've learned throughout growing up here in Chicago and as a physician, there's still so much work that needs to be done, so many health disparities. There's still lack of access to care, some because there's not, obviously, people don't have health insurance, affordability of medications. There's language barriers still that exist. It's gotten better because there's more translator, more everything else too. There's also lack of representation, still a lack of doctors that look like them or speak their language as well too, which makes it hard for these communities. And then I have to say poverty levels are still really high in minority communities. And when it comes to vaccination rates, for example, for flu or even now COVID-19, the levels are some of the lowest throughout the country in the African American and the Latino communities. And this is where I feel like the vaccine hesitancy comes in, and where as vaccine ambassadors and a voice for them, we can really talk to them, talk the science, have that conversation to dispel the myths, to really start that, the path towards knowledge so that we make this community believe in the vaccines and hence get their families and themselves vaccinated.
Mhm. Yeah, you hit the spot of this pandemic has really just highlighted the tremendous disparities that have always been in existence in regards to minority populations, and health care is not equal for all. It sounds like you've really experienced that throughout your career. Would you agree?
Oh, definitely, definitely. And even like through families I saw in clinic, they throughout the pandemic, people losing jobs left and right, and or losing spouses to the pandemic because they were essential workers, and seeing, like wives now having to, raise 4 kids on their own now, and it's just super sad.
No, it really is. Well, I appreciate that background. And speaking of background, going back to your sort of personal career, you spend a lot of time speaking to groups of various sizes and backgrounds. As you mentioned, you're a national spokesperson for the American Lung Association. You spend a lot of on camera, giving media interviews, and speaking in person. Well, before the pandemic, at least to large crowds. So I'm just curious. Do you have any formal training when it comes to public speaking, or are you just a natural?
So, it all goes back to our childhood somehow. But like I had parents, big Catholic families, Mexican. My mom, I was the oldest. Oh, she got a loud voice, volunteered me to read the Sunday lectures in front of 250 to 300 people. So you get comfortable very fast with big crowds. But then I do have to say, I've also gotten media coach training through the American Lung Association. So,
Mm.
we do it once a year as part of our orientation as we enter a new year with Terry Gowdy, who was an ABC7 media coach, who's amazing and has helped CEOs get out of a lot of trouble by coaching them on what to say. So she's amazing.
Oh, that's great. Yeah, I know we can all benefit from some advice from the other side of the camera, shall we say?
Absolutely, absolutely.
Well, that's wonderful. So let's shift gears back to really the topic at hand today. And when you discuss the COVID pandemic with patients in the office setting, so let's go away from the large group and on camera. You have that individual patient and/or family in front of you. Are there any proactive or anticipatory questions that you like to ask? How do you address this?
Sure. So first question that, any family vaccine, even if it's a regular patient visit, if it's, obviously, and the allergy visit, et cetera, first thing I do is a mental health check. I
Mm.
say, I talk to the mom or the dad and even the kid. I said, how are you guys doing with the pandemic? How is Johnny doing with the Zoom learning, et cetera, just kind of checking in. And then my follow-up question is usually, how's the rest of the family? Everyone safe? And that I think opens up the conversation as well, like if they've lost a loved one, et cetera, to kind of talk about it. And then the third question that follows up as I open the conversation is, have you gotten your vaccine yet? Or have your
Mm.
parents been vaccinated? And that starts the conversation in terms of maybe they'll say, well, Dr. Mora, you know, I think I'm going to wait on the vaccine, or, do you think they're safe? So sometimes they follow up with questions, and during that, conversation, before we even start just a regular visit, I get to dispel some of the myths on the vaccine so that they think about it a little bit more. And I think it's beneficial to do it one patient at a time, because the more we talk, then they talk to their family members, and it escalates up a chain, which is really great.
So you just make it a normal part of the clinic visit, just this is what we're going to talk about today. And do people tend to respond favorably to that? Do they open up to you and have a discussion?
They do. As soon as, for example, because you're checking in on their families, so they feel that caring factor as well too.
Hmm.
And because I always, are your parents okay? Are your in-laws okay? It just gives gives them that comfort level, so then they can open up to you at that point, which is really, it's been a nice part of doing it in clinic naturally.
Hmm. Oh, it's very different than just walking in, saying a brisk hello and sitting down and opening up the EMR and start clicking boxes. That rapport is very important, especially now.
Hmm.
Oh, now what about, have you learned any lessons with the work that you do on a national level, in regards to, what you can take back to individual patients and vice versa? How does that sort of interact with each other for you personally?
Sure. So a lot. So now I get recognized even when I go to grocery stores, even if I'm in a mask and a bun, etc. So people people will tend to ask me questions, like even at behind, the lady at the deli, or behind the counter as well too. And then they'll ask me, did you get the vaccine, Dr. Mora? Did you get any side effects? So those were the questions initially. And then my follow-up questions, have you signed up? You're an essential worker.
Hmm.
Have you signed up? And every week I'd follow it up, and then they would have more questions kind of coming back and forth. Same with patients. So, because they've seen me a lot on TV and everything else, especially the older population, I have to say, will pat me on the back, even through COVID times, and say, thank you for doing that social labor of love, and thank you for helping us navigate this pandemic. And I tell them, I do it because I love it, and it's a way to help people keep safe. I mean, I specifically remember at the beginning of this pandemic, and I've become friends with a lot of the newscasters because everything was closing down. It was in March, and then you had these outbreaks at factories like the tortillerias, where like 8 people were dropping dead, and then the rest of the workers didn't know what to do, to keep their families safe or where to head to. And I opened up my doors, Dave, and I said, because they would send messages to the newscasters once all these actual outbreaks were happening, and where can we go? Because their doctors were closed. Everything was on a national, on a local lockdown. And it was just all this desperation. And I remember like saying, well, I'm going to open up my doors and examine them and make sure they're okay, and then start teaching them on what they can do to keep the rest of their family safe. So it was even through the newscast, we would walk through scenarios and make it Maria and Jose. Jose works at this company. They had an outbreak. What is he to do? Like lock himself in his bedroom. Everyone starts wearing masks in the house,
Mm.
etc. So it was really helping them navigate case by case. And I think, now I look back and I was like, wow, it was in a sense, it was very rewarding to be able to help a lot of people at once through the cameras, through media, which is a blessing as well too.
Mhm. Oh, that's amazing. And to highlight sort of that positive public health messaging that you've been doing really since the start of the pandemic, um, on the flip side, in your opinion, where have we collectively failed with our messaging, and how has that impacted the patients we're trying to help? And what lessons can we learn from that?
Sure. I think this debate's still ongoing per some
Mm.
states, but I mean, I would have loved a national mandate on masking early on. Just because I feel that had we all been on the same page and masked early on and given PPE to these essential workers, to our medical personnel, everyone else too early on, we would have saved a lot more lives.
Yeah, that consistent messaging. You read story after story of how 18-year-old baristas working at Starbucks are tasked with enforcing, mask mandates inside their own store, and it spirals out of control. So, yeah, consistent messaging, I think, across the board would have been very helpful.
Oh, yes.
Now, you work with a lot of patients from many different backgrounds, and you have for your whole career, and you've known these communities your whole life, really. Have you noticed different themes or areas of mistrust from, say, those in the Latino community compared with elderly patients, or even those from other underserved areas? What have you noticed?
Sure. So when it comes to for example, in the Latino community, there's a lot of vaccine hesitancy that now we're trying to break down because a lot of them got infected throughout the pandemic. So they weren't protected with PPE. So, Dave, I even heard cases like where workers would come into my office and say their bosses said, "We're not giving you PPE. You're going to continue to work the way you are. And if you want the job, if not, you can leave." And a lot of them didn't have a legal status and needed the money. So I was writing letters to these actual bosses and saying, "This is Dr. Mora, and you have to give PPE to these people," and kind of being a voice for them at their factories, which is really sad. But because of that, because of the fact that they felt such mistrust and not taken care of, now they have a mistrust of the government as well too. Well, one is legal status. Well, if I give my information, then are they going to use that same information to deport me if I get the vaccination? The other one that I hear a lot as well too is, well, I already got COVID because a lot of them did get COVID through,
Mm.
their jobs, etc. So I don't need the vaccine anymore. I'm already protected. Or I already had COVID and my symptoms were really, really mild. So what does it matter if I get the vaccine or not? Is another big one that I actually hear. Elderly population, on the other hand, is afraid of the side effects in the Latino
Mhm.
community, I find. So a lot of them tell me, well, what if I get a really bad fever, I get really dehydrated, am I going to die? What if I die from the vaccine? So it's dispelling those fears of the side effects in the elderly population, and in the younger population, really dispelling the myths and kind of getting them on board with vaccinating.
Oh, that's great. It's funny. I had a conversation just last week, a 14-year-old patient, and his mother said, "Would you talk to him about vaccines because he doesn't want to get one?" And I said, "What are you worried about?" And he pulled his mask down and he sort of like stuck his tongue out to the side. And I said, "What is that?" He said, "It's the palsy that people get." I said, "You're worried about Bell's palsy?" And I asked him, I said, "Where did you even learn about that?" And he said, "I saw it on YouTube." And I went, "Well, that's really fascinating." And then we had a conversation about that and risk. But yeah, it's amazing where people are getting their information from and how that's
Well,
influencing kind of
it's
our decision making.
Google, TikTok now.
Yeah. Oh, yeah. Exactly. Yeah. So right. And when we do start, when adolescents are eligible based on their age, we're going to have very different conversations. I anticipate.
Absolutely, absolutely.
Yeah. So before I forget, do you mind if I ask? And feel free to say no, but have you received the COVID vaccine? And if so, how did you feel afterwards?
So I did. I received the Pfizer, and I ended the year with the first vaccine, December 31st, and my second one
Ah.
was on January 22nd. So I ended the year with a bang. And yes, no side effects whatsoever, Dave. So I joke with my patients and I tell them, I'm Cobra Kai. This is why.
Cobra, I love it. Oh, excellent. Well, congratulations on your newfound immunity. So when discussing the vaccine, so you've talked about some of the issues pertaining to mistrust and things like that, but what do you have a general spiel that you use to discuss the complicated science behind the vaccines? Do you adjust this based upon each interaction? Do you kind of go in with the same 30 seconds, introductory info, or what's your approach?
Sure, because a lot of them also feel like the vaccine was rushed, right? So it's
Hmm.
also telling them that, this type of vaccine science has been in the works for years now. It just happened that COVID-19 came along and it was the perfect virus for this mRNA vaccination to actually work for it. And so what I tell them, very simple, and I give the same spiel whether they're kids, whether they're adults, because we have to keep it simple. So I tell them the way that the Pfizer and Moderna vaccine work is basically we're injecting a little messenger that tells our cells to make spike protein. Then the rest of our body, the rest of our cells, tell it to make antibodies so that way we build protection. So when the real coronavirus tries to infect our actual bodies, then those little antibodies captures all the little spikes around the corona and destroys it and won't let it into our cells and infect it. And this is why it's important that we all do it. For the Johnson and Johnson, I tell them it's an inactivated common cold virus that's also sending this little signal for, again, the making of the spike protein, and then we make our body's response by making antibodies to the spike protein. And again, once the actual real COVID-19 virus tries to infect, then we eat it up and destroy it, which is what our immune system's supposed to do. And this is how we attain protection. I even went for a new segment because I wanted to show people that science really works. I drew my own blood. I had a
Hmm.
coworker who had COVID-19 as well too, and we showed like our actual antibody levels for spike protein develop after the second vaccination. She had it after the first, and so that way we would show people in the public, okay, look, we can actually show it works.
Mm. Oh, that's great. And when you give this sort of spiel, so you're very proactive when you talk to patients. It sounds like. What do you do to sort of read the room? What happens if you sort of see people drifting off or eyes glossing over, or we always have to worry about various levels of health literacy and things along those lines. So how do you sort of adjust on the fly if you're noticing that people maybe not be receiving the information you're trying to give them?
Sure. So then you simplify it even more. So
Mm.
I'll say like, let me explain it, a little bit simpler. And I said, all we're doing is making protection so that way this virus can't infect us. And, vaccines have been around for many, many years. They've eradicated. Then I go into my spiel like if we've eradicated polio, we've eradicated, smallpox, etc. So this is why we have to trust science.
Mm. Great. You alluded to this earlier about historically, there's been a background level of vaccine hesitancy within the Latino community, underserved communities, for all other types of vaccines. Do we have any idea of how that compares with hesitancy regarding the COVID vaccines?
Sure, flu vaccinations are some of the lowest in the whole country in the Latino community.
Mm.
And a lot of the stories I hear for vaccine hesitancy and the flu, well, I got really, really sick when I got that flu vaccine, so I'm never ever getting it again. Um,
Hmm.
so I hear that tons. The other is like, well, I'm really healthy, so why do I need a flu shot? I got a lot of people though to take it this year because with COVID-19 going around, people were actually more compliant with their flu shots, and also going into the community and giving flu shots through mobile care and everything else was really great too.
Mm. Great. And when somebody says to you, "All right, I hear you. Thank you so much. I've seen you on TV. It's all great what you're doing, but you know what? I just kind of want to wait and see. It's a little too early for me." How do you respond to that?
So the way I respond is I tell them, you know, I get what you're saying. It's maybe you want to wait and see how a few people do, but think about getting back to what you love. Um, the trips, the hugging your family members, seeing your mom that you haven't seen in a year. One newscaster told me her twin sister she hasn't seen in a year, and she had a baby. Didn't see her throughout the whole pregnancy, everything else. And I tell them it's getting back for to our normal lives by getting this vaccine, and it's taking back the time spent with family that this virus took away from us. And
Mm.
this is our chance to really do that by getting vaccinated and getting our families vaccinated as well.
So you make it personal and you make it real and a tangible, talking about something they lost in their lives. And do you think
Mhm.
do people tend to respond well to that when you have that conversation with them?
They do. They're like, Oh, I see what you're saying. It's kind of a light hit them because if you touch their heart, that's what I have learned.
Hmm.
You can kind of get them to at least think about it.
Yeah, no, that's great. Well, what about somebody who says you mentioned in the elderly population, people are worried about side effects? How do you discuss that with them?
Sure. So I go through the most common side effects, especially if they ask me, for example, for the Moderna or the Pfizer or even the Johnson and Johnson, and I tell them what the most common side effects are, and then I tell them, but most people do really well. One thing, if they're very frail and elderly, I'll tell them hydrate well, make sure that you get enough rest the day of the vaccine, you take it easy for that day, you keep hydrating, and if you get a fever, then you can treat it. But remember, that's your immune system kicking in for the protection. And most side effects, I tell them, mostly last 24 hours. Very few people actually wind up going into a longer realm of symptoms. And I think it's, it's important overall that you get it because the actual 65 and older population was the hardest hit with COVID-19.
Yeah, it's interesting. I've taken the same approach, and I know the public health messaging is as well of, side effects are really our immune response, and it's a good thing. And it says that our immune system is doing great with the vaccine and it's working really hard and so on and so forth. But then every once in a while, somebody says, "Oh, I didn't have any side effects. Does that mean that the vaccine didn't work for me?" I don't know about you. I struggle when people say that to me. Do you have any response to that or?
No, so what I tell them is everyone is different, So I like for example, I just say, well, I was exposed to everything when I was in medical school, which is true. You and I were
Mhm.
exposed to everything when we were in medical school and training. So we probably wouldn't get as many side effects and so forth because we have this strong built up immunity to begin
Mm. Yeah, that's great. Now, you sort of
with.
touched upon this of how when you discuss hesitancy, it's not just risk benefits of the vaccine, but really comparing it to risk benefit of actually getting sick with COVID, especially in those populations at very high risk. In your experience, are people thinking about these decisions as isolated dichotomies like vaccines are good or bad, or do they seem to naturally consider these different aspects of vaccine versus actually getting sick with the infection? What have you experienced when you have these conversations?
Sure. I think they often think of them as separate.
Hmm.
So they look at the vaccine and then the getting sick. So then it's kind of nice to bridge them together. So that way you can say, but the vaccine actually imparts protection and will help to lower the risk of you getting sick and landing in the hospitalization. And they're all wonderfully effective, all three vaccines out, at decreasing death and hospitalization, which is the ultimate goal. And I tell them it's getting to that herd immunity, which is where we want to go, where it's back to living without masks, with, hugging and being together again with our family.
That's great. I don't know if you saw this, but on March 5th, the New York Times published an op-ed by Dr. Rhea Boyd, who's a prominent pediatrician and public health advocate, such as yourself. And the title of this op-ed was "Black People Need Better Vaccine Access, Not Better Vaccine Attitudes." And within, Dr. Boyd offered some insight on how to approach vaccinating the Black community, especially, and suggested that the major issue isn't really a mistrust of vaccines as much as it is just lack of access, and really that informed decision making does occur if they're just given the proper information. I don't know if you read that or not, but do you have any thoughts or experiences along those lines?
Sure. Yeah, it was a great article actually. So,
Yeah.
and I think she's really right on many things, and I think like for example, even through the whole vaccination rollout, they are, every state is trying to get to these hard hit communities by, maybe making a priority of zip codes or everything else too. But then there's things that defeat them. So for example, the technological issue, especially in the elderly, like registering. So if they don't have a grandchild or a child who will register them, on an iPad or because there was no phone line either to get registered, then they're so lost. Like, they interviewed a little old man standing outside of United Center who didn't know how to register, and he was just standing out there hoping that he could get a leftover vaccination, and he had
Mm.
been standing out there for hours. So it really speaks to not only, I think, in African American or Latino communities, I think that that one was across the board for the whole elderly population. Like I felt we should have done more outreach in terms of making it more technologically friendly. Then in the Latino community, it was also the language barriers. So a lot of it was in English to get to. So the Spanish translation came a little bit later. So it was hard for them, even as essential workers, to get these vaccines as well too. So there were lots of barriers that way. And because on social media, so people would write to me and they say, "Well, I want a vaccine, Dr. Mora, but please don't say that people don't want the vaccines. It's just that we don't have access to them." And it was these, I think, technological difficulties that were making it hard for them to have access.
Yeah, that makes a lot of sense. And you're right. I hope that, they continue to the powers that be across all the different states and locales. I hope they continue to work on that and address these major issues, because that's a huge barrier, as you stated.
Mhm.
All right.
Absolutely.
You've imparted so much wonderful knowledge on us, and as we sort of wrap up here, I'd like to just tap into as much of that as we possibly can. So, shifting gears a little bit, do you have any advice on how practicing allergists can help their patients in regards to medical decision making surrounding COVID vaccines? You've sort of given us your approach, but any pearls of wisdom or tips that we can all take from this?
So, Dale, I'm going to totally be impartial in this, but next to infectious disease, I think we were the second actual specialty that was really great in this pandemic because we're the immunologists. So we're really trusted by our actual peers and also by our patients. So I think starting the conversation, they believe that we know science, and which is
Hmm.
great, that we know immunity, that we know the immune system, et cetera. And we're the ones that deal with reactions from vaccines. So when, for example, when the allergic reactions were happening, who were they calling? All of us
Hmm.
as allergists, et cetera. And even when it comes to for example, how these vaccines work, I think we can break it down really easily for patients. So I think starting that conversation with them and kind of getting them to tell you what their fears are will help to impound our own knowledge to help them and guide them into hopefully making the decision to get vaccinated for themselves and their family. And it's also a nice mental health check because this pandemic has been hard on so many people on many levels, young and old, everyone. And I think it's nice to just kind of check in as well too and say, how are you doing through this pandemic? How's the family? And just shows that caring factor that we all have, which is why we went into medicine and start that conversation and really be vaccine ambassadors, even if it's one patient at a time.
I like that, vaccine ambassadors. And I couldn't agree more with you, Dr. Moore. And, let's face it, as allergists and immunologists, we're the nerds of medicine, right? Um,
Yes, we are.
we sort of, we what we understand is often poorly understood, and many of it we love this. We love understanding the very complex immunology and pathophysiology surrounding all of this. So I think it's time for all of us to embrace our inner nerdum and rise up and face the challenge. So thank you for that.
Nerds rule the world, Dave.
That's right. Well, yes, so speaking of ruling the world on a broader level, so we talked about individual patients. What else can our specialty do to help with public messaging and sort of on a broader level? This isn't going away tomorrow or next week. We can always do more. So how can allergists and immunologists help on that broad level, like you are?
So maybe having vaccine ambassadors, actually, like different nationalities across the board, and then kind of give a
Mhm.
message to their own community. And it can be in their language. So it can be in Spanish, in Korean, in Chinese, in Hindi. And it just so that way it's someone who represents them and it's, a real message to their community. And I honestly, there should be also a multinational, I wish, campaign where every specialty, allergy and immunology, OBGYN, peds, everyone kind of comes together and says, we support vaccinations for the COVID-19. Let's get back to what we love.
Hmm. Yeah, I know the hashtag "This is our shot" is being used by a lot of medical professionals as they post pictures of themselves getting the vaccine. But as you mentioned, a lot of we all look the same. They look like me. There's a lot of white people out there saying this is our shot, but
No, no,
it's
but that's great. No, we need
yeah.
everyone though.
Yes, exactly, exactly. Do you have any tips for the rest of us in regards to how do we stay on top of all this? The knowledge and understanding and messaging has shifted from the start of the pandemic, and sometimes it shifts very rapidly. Just within the last week of when we're recording this, the Centers for Disease Control came out with new guidelines for those who are vaccinated about getting together inside, in small group settings and things like that. So, how can we all stay on top of this so that we can provide current evidence-based information for everybody else?
Sure. So CDC is a good website for it, and Quad AI, you guys do a great job as well too. And I love seeing the posts and so forth on the updates because it kind of keeps us current as well too. And I love just also checking in on CNN as well too because I love hearing, for example, the peds, what's happening in pediatric, and for example, the Moderna trial starting for 6 months to 12 years of age. I love seeing all these little tidbits that will hopefully help us navigate out of this pandemic. And I always tell people, other doctors and peers, it's in this sense, look at us. We're the doctors. We're the ones helping in this pandemic, and it's really a blessing that we're the ones to be able to help people navigate out of this pandemic, and we get to use our knowledge to help them and reassure their fears. In a time of so much darkness, we get to be light, and that's a gift.
Absolutely. Personally, how do you sort of stay on top of all this? Do you set like Google alerts, or do you just have go-to websites that you try to visit every morning or evening, or do you use social media, or what's your approach?
Sure. So I'm a morning person, so I usually wake up by 5 a.m. So 5 a.m. I usually read. I tend to go to CDC website, see if any updates. I go CNN as well too, and then I'll hit some of the journals as well too to see if there's any breaking stories for the morning. Because then I know if there was a breaking story, then I should be prepped because I'll probably get a call during the day to break that story. So I kind of want to be familiar with it, etc. And it
That's
helps
great.
me talk with patients as well too of anything new occurring.
Yeah, I love it. I also try to read in the morning as well. I'm a member of the 5 a.m. club, just like yourself. But yeah, it's because the information evolves so rapidly that I think we all have our homework to do just to stay on top of everything these days.
Sure.
All right, here's the hardest question of all. Are you ready?
I'm ready.
What are you, Dr. Juanita Mora, most looking forward to doing once the pandemic allows us to resume some semblance of pre-COVID activities? What do you miss the most? What can't you wait to do?
So my family and I love to travel, Caribbean, Mexico, etc.
Mm,
And my favorite thing is, because I'm the 5 a.m.er, is going out and just sitting by the beach with a cup of coffee and just hearing the sound of the waves
mm.
and turning off my phone for a week. Disconnecting from the world.
Oh, that sounds amazing. Oh, that yes. Well, I hope that you get to do that as soon as possible. That sounds great. Dr. Mora, I can't thank you enough for taking time to be with us today. This was a wonderful conversation. I think you gave us all a lot to think about and consider as we address, vaccine hesitancy with all of our patients. And this was very insightful. Do you have anything else you'd like to add before we say goodbye?
No, thank you to everyone listening, and stay safe. And we'll meet at the Quad AI for some coffee
That
next
sounds
time.
great. Oh, thank you so much. We hope you enjoyed listening to today's episode. Please visit www.aaai.org for show notes and any pertinent links from today's conversation. If you like the show, please take a moment to subscribe to our podcast through Apple Podcasts, Google Podcasts, or Spotify so you can receive new episodes in the future. Thank you again for listening.